I'm Peter Block in Chicago at ACC 2016 for On the Scene. And I will bet you that not many of you folks out there are struck by terror when you think of Chagas disease, but I will tell you, in Venezuela and in Colombia, it is an ongoing problem, and there's a lot of people in the United States who are positive already. So with me is Carlos Murillo from Colombia, actually from McMaster, right? And Carlos has done a very interesting study on therapy for Chagas, which will be a very important bit of information for all of those treating this disease. So Carlos, tell me about the study to start with, and then we'll talk about outcomes.
Yeah, well, this was a study we did in Colombia, Argentina, Guatemala, and Mexico. And basically what we wanted to do is test a drug that's called posaconazole. That is an antifungal drug that's been in the market for a long time, but just by serendipity, it was seen that it has good activity against T. cruzi, which is the agent that creates Chagas disease. And we wanted to compare it alone and in combination with bisnidazole, which is the standard medication that we use for therapy, but that unfortunately has a lot of side effects. So what we did is that we did a proof of concept trial in about 120 patients, 30 per group, and we randomized these patients to either the posaconazole alone, placebo, bisnidazole plus posaconazole, or bisnidazole plus placebo.
Okay, so who's the winner?
So actually the winner is the old guy. Bisnidazole actually had a good activity against the parasite that we detected by looking at real-time PCR, so we're detecting DNA of the parasite. By 30 days, almost 95% of the patients that received bisnidazole alone or in combination with posaconazole were negative, and they maintained negativity for a year. Now, in contrast, posaconazole had good activity in the first 30 to 60 days, which is when treatment is given only for 60 days. But once treatment was stopped, almost 80% of the patients became positive again, which means that probably posaconazole has a trypanostatic effect and not trypanocidal.
Okay, so let me ask you a cardiology question, because this disease causes right ventricular aneurysms and heart failure. When can you still make patients better?
That's a great question, and at the ESC we presented the BENEFIT trial, which actually was the largest trial in Chagas disease, randomized almost 3,000 patients in 5 countries that already had some early cardiomyopathy to bisnidazole or placebo. And unfortunately we didn't see any effect. So probably it's earlier stage like the STOP-CHAGAS, which are patients that have the infection but still don't have any cardiomyopathy. These patients had a negative ECG and a normal echocardiogram. So probably early intervention is where we're able to probably delay the progression of cardiomyopathy.
All right, so you've had it from the mouth of the expert on Chagas disease, and a quick review of the whole disease, including cardiomyopathy secondary to it. Treat early sounds like the right answer to this, and now we have a good treatment for it. Thank you very much, Carlos.
Thank you.